please introduce yourself?
I'm Bonhomme. I'm a physician in public health and preventive medicine and also addiction medicine.
Can you tell me a little bit about what you spoke about today here at the Prostate Nut Symposium?
Well, I've been working with the issue of trying to get men more engaged in healthcare for a long time, largely because of the very high death rates of African American men. And one of the things that we did, we tried to do various type of health outreaches to men, and we started to realize that the health issues of different groups, men, women, children, minorities, they're all integrated. One group can severely affect the other. People act as though men's health was out there by itself and it didn't affect women and children, but it affects women and children economically, it affects them in terms of their health, it affects them in terms of family stability. So, really, we talk about men's health and women's health. Really, you can't have one without the other. It goes both ways. If women weren't healthy, that would badly impact men, but men's health problems and premature death are impacting women adversely as well.
What do you think are the main factors contributing to men's avoidance of healthcare?
Well, first of all, men are taught to take pain and not to respond to fear and to ignore the signals in their body. We're taught to be tough, to push through the pain. Don't give in, don't give up easy, keep on going, tote that barge, lift that bale. Ours is not the reason why, ours is about to do or die. We also are taught to be very self-reliant. Do things for yourself. Don't worry about getting help from anybody else. A real man takes care of himself. Also, there's a lot of lack of information about men's health out there. Look at how much attention breast cancer has received compared to the amount that prostate cancer has received. A lot of men just don't know what the issues are. They don't seek out medical care because they don't understand what the issues are, and they also haven't been educated as to the benefits. How they can be stronger, how they can stay young longer, how they can do the things that make them feel like men better if they take care of their bodies. And it's amazing. You look at how men take care of their cars. The car burns one drop of oil and makes a funny noise. The guy's under the hood like a lightning flash, but he won't go to the doctor for chest pain. It's a real contradiction where men have been taught to take care of other things but not take care of themselves.
How can public health organizations like the Prostate Net and the organizations that you spoke about today, what can they do to help overcome these barriers?
Well, I think the first thing that they can do is to put the word out there, basically to educate the public that prostate cancer is a real issue, that there really is help out there, that men need to be screened, and men are not just prostates, men need to have a connection with the healthcare system overall. I think one of the things that we need to do, since statistics show that young men tend to drop out of healthcare right after the pediatric age group, they don't tend to go to doctors anymore until they're in middle age. I think that we need to try to form a stronger connection between men and the healthcare system. And one way to do that is to make sure that men understand that good health helps you perform well. Some people would put it, I like to put it as better health makes better men. You can be faster, you can be stronger, you can be more virile, you can work better, you can have more concentration, you can be more attractive to the opposite sex, you can stay young longer if you take care of yourself. And your doctor is your ally in helping you to take care of yourself.
One reoccurring theme that coming up today was the PSA controversy. Do you feel that men should go for annual PSA tests starting at age 40 or 50, depending on what population they're a part of?
I definitely do, and one of the reasons is because the recommendations that were saying that men should not be screened for PSA unless they're symptomatic. Prostate cancer is one disease that by the time you're symptomatic, it is likely to be very advanced, and there's not much that can be done about it. The basic issue, they were saying that the PSA test wouldn't save that many people's lives and this, that, and the other. But the studies weren't long enough because prostate cancer in most cases is a slow-growing disease. So if you examine over 10 years whether the PSA test makes a difference, you may not see that much of a difference. But when you start to go out to 15 years and longer, you start to see that it is beginning to make a very big difference. So I think that it is very important for men to be screened, not only for prostate cancer, but the PSA test doesn't just pick up cancer. It picks up prostate enlargement, it picks up infections of the prostate, it picks up other conditions. So the point is, I think it is good for men to be screened and to have somebody make very careful and cautious decisions about what to do if there's an elevation. Some people will look at, they won't look at a single PSA test, they'll look at the difference between two PSA tests taken months or a year apart, and how fast it's growing. Maybe it may be a good indication, but I definitely think that men need to be screened, and PSA testing also forms a reason for men to go see the doctor overall and get evaluated for other things. Right now, we're in a situation where men will go to the doctor because they're having sexual difficulties or something like that, and then they find that they've had diabetes or high cholesterol or high blood pressure for the last 10 or 20 years. They're really not in that good shape by that time. There's not as much that can be done as if they had been picked up earlier. So I really think that PSA testing is important. We need to have men connected to the healthcare system.
Final question for you. If you had one statement to make, a plea, cry to your fellow man, what would you tell them about their health?
I say better health makes better men. Consider your doctor your ally and your friend in helping you be a better man to help you protect your manhood from disease.
Thank you so much for your time today, doctor.
Thank you.